A bad hair transplant can be corrected. That's called repair hair transplant. Hi, I'm Dr. Arvind Poswal from Dr. A's Clinic, Delhi, India. Today I'm talking of a very special topic. If you have got a hair transplant done and it is not up to par, or it is a bad looking hair transplant, then what to do about it? And if possible, how to avoid it, and if you cannot avoid it, you have already got it, then how to correct it. So let's understand, why do we get bad hair transplants? Why is there such a requirement for repairing bad hair transplants? After all, it is a medical procedure. Almost every doctor doing it should know how to do it correctly. Unfortunately, that is not so. World over, there are about 20 doctors who invented the major things in this field. I am one of them. And even we 20 doctors are not each other's friends. We just happen to have been at a crucial time. We worked hard, someone invented something, someone else invented something else. But there was never any government regulation or requirement or any inclination also to be teaching it regularly on a long-term basis in medical colleges. You can't teach hair transplant to doctors in medical colleges, not the modern hair transplant at least. Maybe some old-fashioned transplant like a few plug grafts or something you can do. But a modern-day hair transplant is usually a 2-day surgery, each day about 7 to 8 hours at least, and that is not done in any medical college. So that is the first problem. You are not getting a standardized doctors. What you are getting is doctors who are maybe getting excited to know that yes, they can do hair transplant, and each of them trying to learn hair transplant. Some learning them from YouTube, some learning them from a single day or 2-day workshop. Few of them actually going and learning it for a proper 6-7 months under a senior doctor who already knows how to do it correctly. So there is a huge range of people, all of them thinking that they know how to do transplants, and each of them trying to convince the patients to come to them. So what does the patient do? You as a patient should be focusing only on art. Remember, here when I say hair transplant is an art, I mean that it is an art that is only incidentally performed through surgery. It's not a surgery that happened to look artistic or happened to look nice. It is an art form for which we have to perform a surgery, but in the end, the person doing it has to be an artist. He has to have a sense of art. Otherwise, you get all the bad hair transplants. I see people with hair growing like this. I see people with hair growing in all the wrong places. Hair standing out, pointing to the skies. That is not how hair grows in nature. And that is not what a hair transplant should be called. If you say that technically you take a root from one place and put it in another place and it grows and that is hair transplant, then I disagree with you. That is not a hair transplant. A hair transplant is one where we transplant hair in such a natural, correct angle, direction and way that afterward it's very difficult to make out that any surgery has been done. That hair transplant should look that natural. The directions, the angles, the placement of the grafts, the density, everything should look good. So how will you as a patient come to know this? There is only one way. See results. Go through the photo gallery. See 100 results. See them, observe them minutely. See if there is any Photoshop done anywhere. See if wrong angles are done. See if you don't like, if you disagree with the placement of the hairline. And make a plan for yourself that if you want to go, then you want a hairline only in this point and nowhere else. And then when you discuss with your doctor, whether me or anyone else, you'll have some set goals. You'll know, okay, this is what I want. And your doctor should also know that, okay, this person wants a hairline like, let's say, Tom Cruise. If he can't give it, he should be able to tell you the truth, right? So if I can't do a hairline for you, that is your dream hairline, then at least I should be able to tell you that, okay, you do not have grafts, but I have done similar hairline for someone else. See, look, this is the result. So that is how you choose. But once you have got a bad hair transplant done, then also do not lose heart. That is the time when you have to be extra careful. Why? Because now is the time when a patient goes into a sad, depressing stage. Most of them do not trust their doctor after this. Their face has been spoilt. Many instances in such a way that the patient cannot go around without a cap throughout his life. So that is the situation where they need to have faith again. Do their research. See, good doctors, even if they are few and far between, they can correct you, correct that mistake and make you reasonably good looking, if not perfection. So in case you have any friend or any relative, son, brother, anyone who has had a bad hair transplant, I know many of them, once they have got a bad transplant, they feel so disgusted, they don't want to look at another video of hair transplant. But if you find that what I am telling is something which will benefit them, then do tell them, do share this video with them, ask them to see this, show them what is possible. I don't want anyone roaming around with a bad hair transplant, because till the day anyone is roaming around with a bad hair transplant result, people will keep on thinking that that is what a transplant looks like, not realizing that a good transplant is something that a normal public person cannot distinguish. They should not be able to make out that a transplant has been done. That is what is still possible in most patients, because there are a lot of donor hair which is still available from the beard, from the body, even from the head. I have found these clinics or doctors who are doing substandard work usually leave out much of the good donor, which we can use to do the corrective surgery. So do not lose heart, and remember to like this and share this video and subscribe to the channel also. It really helps. Thank you.